Okay, now we have a very big left-sided varicocele. In the examination, I love to use this Doppler ultrasonography device because I don't want to send the patient to radiologist and wait for the results. And they are looking to patients when in the laying down position. I don't like it. I look it by myself. So this is right testicle. First thing I do, I look to testis for a possibility of a tumor, and there is no tumor in the right testicle. This is right testicle, and this is the upper pole of right testis. And here we have the veins and arteries of right testis. And here is the ductus deferens, vas deferens, spermatic channel of the right testis. This is a very normal view. When I look with color Doppler, you see the arterial pulsation. The blood is entering into the testis. We can see blood in the testis normally. And this is a normal anatomy, normal patient. We don't see any veins. We see only the pulsation of the artery, and now we see vas deferens. And vas deferens, ductus deferens, spermatic channel, it has also its own arteries and veins. So there is no vein now. Now, bakın bakayım. When he strains, we see for 1 or 2 seconds, tekrar bakın, the veins. Then they disappear. This is a normal testicular blood supply, no varicocele in the right side. When I look to left side, he has a grade 3 varicocele, which is visible with, look at this vasculature. It is extreme. All the veins are filled with reflux. When I close the color, you see very large tortuous veins here. You see it is turning like that, coming here, then going there and turning back, making circles. When I measure the diameter of this vein, 6 millimeters. It is huge. So this is one of our main difference. I don't want just to palpate and make the diagnosis, but I want to see with Doppler, because sometimes when we send this patient to radiology department, they look with the patient in laying down position and the veins become smaller. And I want to see what will I face inside the operation, what will I see, because sometimes even we see these veins, when the patient lays down in operation and sleeps, they disappear. And sometimes we say, oh, there is no vein, but it's not true. In this patient, I will take the photo of these, and then in the operation I will look and say, okay, in this patient I have to find very huge veins like this. So this is one of the most important parts of our technique. We are very experienced in varicocele surgery. It's our main interest. And we examine all patients in such a way with Doppler at the beginning. And inside the operation, we use intraoperative Doppler, microvascular Doppler, because you see there is an artery. Look at this. Very thin. Very thin. It's very difficult to find this one. It's pulsating. In the operation, these vessels are obscuring this one. It is surrounded by veins. So with only microscope, sometimes it is not very easy to find this. We check all the vessels. Here is another artery pulsating. I can change the color to make it red. This is a different artery. This is a different artery. There will be 3 or 4 arteries. We have to check each of them. So we are very experienced in these techniques, and I use the Doppler device before the operation, after the operation, inside the operation, another microvascular Doppler, and we take out these veins completely. Just inside the operation, we finish this. In classic operations, they just ligate these veins, and it takes too much time for these veins to disappear. And sometimes they never disappear. So we will take this vein out and look for the other thinner veins and maybe ligate some of them, take out some of them if possible. This is a very good candidate for this operation. His testis is a little smaller than right one. He needs the operation.